It's important that we recognize that not all materials are suitable for autoclaving. Certain food items, things like milk and cider and fruit juice or even wine, these are things that would not be good choices for placement in an autoclave. And that's because the process of autoclaving can significantly change what these foods taste like. Now, we still want to be able to control the growth of microbes in these food products, but we don't have to achieve sterilization to do that. We can use heat and pressure at levels below what would sterilize these foods in a process called pasteurization. Pasteurization was developed by Louis Pasteur, and pasteurization does not sterilize. However, it does drop the number of microbes inside of these particular types of foods to a level that allows the food to be consumed safely. Now, there are two kinds of pasteurization that are currently being used commercially. One is called flash pasteurization, and one is called bulk pasteurization. The bulk process is the older version of pasteurization. The bulk process uses a longer heating period and then a slower cooling down period. In comparison, flash pasteurization is a much newer process, and it uses rapid heating for a much shorter amount of time, followed by a rapid cooling down period. Now, you might imagine that flash pasteurization is more expensive than bulk pasteurization. So we still use bulk pasteurization for a lot of foods, most commonly for dairy milk. Dairy milk is bulk pasteurized. Flash pasteurization is usually reserved for sort of the high-end, expensive foods that require much more careful preservation of their flavor profile. So wine, for example, and certain types of cider might be flash pasteurized because the profile of flavors inside the product will be better preserved with flash pasteurization. So it's important to remember that pasteurization does not sterilize these liquid foods. What it's doing is reducing the microbial cell load inside that liquid food. There's still going to be some microbial cells in the milk and in the juice and in the wine afterwards. It's just that we know that pasteurization tends to kill most of the common pathogens that might be found in these liquids. And we know that the microbial load will be reduced enough so that that food will be safe for consumption, at least for a certain period of time. In other words, it will increase the shelf life of these liquids. In terms of the pathogens specifically that were targeted when pasteurization was first developed, it used to be quite common for the organism that causes tuberculosis, for example, to travel in milk and other liquids. The organism that causes typhoid fever used to be problematic in some of these liquid foods. So pasteurization has done a lot to protect human beings from exposure to certain pathogens. And again, it helps increase the shelf life of these perishable liquids. That's why when you go to the grocery store and you pick up a half-gallon of dairy milk, when you bring it home and put it in the refrigerator, you can count on that milk to stay fresh, to stay consumable for a couple of weeks. In comparison, if you were to milk the cow yourself and take that raw, unpasteurized milk and put it in the refrigerator, that milk would spoil within a couple of days. I want to switch gears now and talk about the second method of physical control of microbial growth, and that's a method using radiation. Now, there are two types of radiation that are routinely used to control microbial growth. The first is ultraviolet radiation, and the second is ionizing radiation. And in the ionizing category, we're talking about X-rays and gamma rays. On this slide, in the lower left corner, you can see an ultraviolet bulb in a lighting fixture hanging from a ceiling, and that ultraviolet light is shining down on a workspace in a laboratory. Ultraviolet light actually works very nicely to control the growth of microbes on hard surfaces. Up on the right-hand side, you're looking at a industrial-sized unit that can apply ionizing radiation. I believe this is an X-ray unit that can apply ionizing radiation to certain packages and also control the growth of microbes in those packages. Now, there's a couple of things we need to know about the use of ultraviolet radiation for controlling microbes. Recall that ultraviolet radiation is on the spectrum of electromagnetic radiation. It has a wavelength range of anywhere from about 15 nanometers up to about 400 nanometers. The biocidal wavelengths, though, the wavelengths that are best at killing living cells, fall into a range of about 220 to 300 nanometers. So that's the wavelength of ultraviolet light that you would want to use if you were trying to use the UV to kill microbes. Now, ultraviolet light has some advantages and some drawbacks. The way it works is it is absorbed by DNA. And recall that all living cells have DNA inside of them as genetic material. When that DNA absorbs the ultraviolet light, it becomes damaged. And once it's damaged, the cell can no longer replicate it normally. The enzyme that comes through and makes copies of the DNA molecule during binary fission is going to encounter these damaged areas and not be able to copy the DNA correctly in those areas of damage. And what ends up as a result is mutations occur. Now, those mutations might be repaired, they might not be repaired. So the end result is that cells that are exposed to UV may end up with mutations inside of them and even lethal levels of damage. One of the biggest disadvantages to the use of ultraviolet radiation as a control mechanism is that it does not penetrate very well. Ultraviolet rays can only penetrate to a level of about 2 millimeters. So while the ultraviolet rays are more energetic, they are more powerful than, say, light in the visible wavelength range, they are not powerful enough to penetrate material the way that, say, X-rays can. 2 millimeters, that's it. And that's why, as I'm sure you're aware, when we are out in the sunshine and we're being exposed to ultraviolet radiation, our most vulnerable structures are our skin and our cornea on our eyes, because those are the places where the ultraviolet radiation can penetrate to that 2 millimeter depth. So if we're going to use ultraviolet to control microbial growth, it is most effectively used to disinfect surfaces, hard surfaces. It works really well in that application. We use ultraviolet radiation to disinfect laboratory benches, to disinfect the flat surfaces inside laminar flow hoods that we might be doing experimental work in. We use ultraviolet inside hospital rooms. We use it in food preparation areas. It's an inexpensive, easily used way to control microbial growth, but it has limitations. On this slide, you can see a couple of images of ultraviolet devices. Over here, this one on the upper left, this one is actually in place in a restaurant in the food preparation area. You can see that, again, the ultraviolet bulbs inside this light fixture up on the wall. Ultraviolet is used quite a bit in the restaurant industry, the food preparation industry, in packaging facilities where perishable foods are being handled. Of course, you would not want to leave this device on with workers in that area unprotected from that ultraviolet, right? Because they are also susceptible to the kinds of DNA damage that microbial cells are susceptible to. Over here on the left, you're looking at a room inside a slaughterhouse facility. You can see these sides of beef that are hanging on this pulley system, and they're going to be passed down along these pulleys underneath ultraviolet lights, so that any microbes that might be on the surface of this meat, that might be on the outside surface of this meat, will be affected by the ultraviolet light. The image down on the lower right I put in sort of as a cautionary tale for us. I pulled this image out of a catalog. It's one of those high-end catalogs that you sometimes get in the mail that sells very pricey little gadgets that are designed to make your life easier. This particular catalog was advertising this device right here that you can see in this woman's hand. This is an ultraviolet wand. So it was being advertised for travelers to stick inside their suitcase and bring with them as they go from hotel room to hotel room, so that they can disinfect surfaces in the hotel room. Now, that all by itself is not a bad idea, as long as you know what surfaces it works on and what surfaces it doesn't work on. And you can see in this picture, this woman is using this wand on exactly the wrong kinds of material. She is passing it over a pillow and soft, thick bedding, I assume in an effort to disinfect that bedding. Remember, ultraviolet works really nicely if you're trying to disinfect a hard surface. It does not work well on soft, squishy materials like this bedding. What you're looking at on this slide is one of the most recent advancements in the use of ultraviolet light in the hospital. This is an ultraviolet unit. As you can see, it's on wheels. It's a large piece of equipment that has ultraviolet bulbs all the way around in 360 degrees. And what they've done in this picture is they've taken this unit into a patient room, obviously with nobody in the room. So after the patient has left, and also after the room has been cleaned, after the room has been cleaned out, this device is rolled into the room and turned on, and the door is closed. And this device is left for a certain amount of time in an effort to, again, disinfect hard surfaces in that room. Now, as you can see from the picture, the beauty of this kind of ultraviolet use is how well it travels around that room. It's hitting surfaces that may not be easy to disinfect by hand with cleaning chemicals. The light is going to hit surfaces in 360 degrees. It's going to get into little cracks and crevices. It's going to get to places that, again, might have been missed when the cleaning crew came in and applied soaps and other disinfectants. So these kinds of ultraviolet units definitely have their place in the healthcare setting, and they add a level of protection for patients in these places where sometimes it's very difficult to control the growth of microbes.